Hey friends, I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. It is a beautiful night. I'm in the barn, and the weather's great. It feels great, and we are hanging out. We're going to do an episode today about something that I have been hearing about on the internet. So I have been getting a bunch of DMs lately from followers, and anytime I get repeated messages from people with the same sort of medical veterinary type question, I always know that there is some hot steaming pile of misinformation somewhere on the internet, and turns out that is true of these questions. So little bit of searching, found some content that is going a little viral right now about this topic. There's always some type of misinformation about this. It's definitely ramped up lately. And so I think we need to talk about it. And I want to just give you all a veterinarian's explanation of preventative products for your pets. So heartworm, flea, and tick prevention. We have episodes coming up in the future about specific parasites and diseases. And so we're not going to get into the nitty-gritty of like what heartworm disease is, but I just feel called to give you pet owners just an overview of here's the deal with preventions, here's what people are talking about, and here's why we recommend them if we do. So I hope this is helpful. We're not really going to get into different brands of prevention. Specifically, I'm going to talk to you about the different drugs and how they work and why they work and safety and things like that. And then it's easy for you to see what brands fall under those categories. So that's what we're going to do. We're just going to talk about preventatives. I have some questions that you all have sent me about prevention. You have a lot of questions. People are confused. So it shouldn't be confusing. This shouldn't be a very hot topic, but unfortunately it is. And the fact that a lot of people are getting scared to give prevention, there are dogs and cats that are contracting diseases because of it, and their health is suffering, and some humans' health is also suffering because of it. And it is really unfortunate. So we're going to talk about it. And I would just like to preface this conversation with, if you think that, veterinarians are lying to you and we just are bought out by big pharma and I don't actually care about your pet and I want your pet to be sick, you won't find this helpful. There are people out there who think that, and it's sad. And I have just resigned to saying I can't convince people that that's not true. We can't. And so if that's what people want to believe, that is a sad reality. It isn't true, but it is what it is. So if you trust that veterinarians, for the most part, mean well, and we want good for your pets, we want your pets to be healthy, we want you to be healthy, then you may find this helpful. So I don't have a hot take because this whole thing is a hot take. And clearly I'm still in my scrubs. I worked all day today and I just really wanted to come chat with you about these things. So let's talk about preventatives. I'm going to talk about these in the context of the United States of America because that's where I live and that's where I practice, and I can't speak for other geographic locations. But in the U.S., there are several options of preventive medications for heartworms, intestinal parasites, fleas, and ticks. There are a lot of options for pet parents to use, and that can get confusing. So we're going to kind of break down what you need to keep your pet covered. And there are different drugs that are actually used in those different products. A lot of these drugs do the same thing. So we're going to kind of cover that. And these medications have been around. Not all of them have been around for a long time, but these classes of drugs have been around for a long time. The idea that your pet needs preventative has been around for a long time because these parasites have been around for a very long time. So let's talk about the parasites that we're covering. We'll do that first, and then we'll talk about medications. So heartworm disease is, I would say, probably the most important parasite that we want to protect against. if I had to pick one, heartworm, when again, we're going to have an episode on heartworm disease. So very brief overview on what heartworm disease is. If you didn't know, heartworm disease is an eventually fatal disease that dogs and cats both can contract. We're going to get into the difference when we do our heartworm episode, but in dogs especially, this can cause fatal cardiovascular, pulmonary issues. Dogs will go into respiratory and heart failure because of heartworm disease eventually. But for it to progress to that, it takes a long time. And so there is a very sort of complicated life cycle where heartworm becomes adult worms that actually cause very serious disease in dogs. And that all starts with mosquitoes. So mosquitoes are the vector that carries heartworm disease. They actually inject dogs with microfilaria, which are the larval stage of heartworm. And if you live anywhere in the United States where there are mosquitoes, it is impossible to completely control mosquitoes from being in your house, in your car, in your yard, anywhere. At least here in the southeastern United States, we have mosquitoes on steroids. They are everywhere. I just got bit by one here in the barn. So some mosquitoes carry heartworm disease. That's where heartworm comes from. So, if you live in an area where heartworm disease is present, which is most of the United States, then your dog and cat are at risk of contracting heartworm disease, and that is from mosquitoes. So that heartworm is a big one. We have lots of preventative options for heartworm disease. The other parasite that a lot of heartworm prevention covers are intestinal parasites. So intestinal parasites are different from heartworms because they generally reside in the GI tract, and that is how they're contracted by oral fecal contamination. So dogs eat poop or they lick a surface where poop has been. Intestinal parasites generally shed eggs in stool, and so dogs pick up the eggs. The eggs get into their GI tract, and they become adult parasites. So there are a few different types of intestinal parasites we see that we can prevent with these medications: roundworms, hookworms, tapeworms, and whipworms are all kind of the main intestinal parasites that we see that we can, in general, try to prevent with these medications. So heartworms, intestinal parasites, fleas. Most people know what fleas are. They're these very gross, small, jumping, running ectoparasites. So you can see fleas with the naked eye. If you've never seen a flea, they look like a small, like a sesame seed, sort of. They're dark, and they'll be there, and then they'll either crawl away really fast or they'll jump, and so they kind of disappear. They're very gross. So fleas are a huge problem in dogs and cats. Not only do they cause severe itching, they cause dermatitis, secondary skin infections. Some dogs and cats have severe allergies to fleas, and so they'll have a very exaggerated hypersensitivity to fleas and flea bites, and so they can cause major skin issues. They are also miserable. If you've never seen a dog or a cat with a flea infestation, they are miserable, and it is just terrible to see. We do see small puppies and kittens become actually anemic because they are so flea-ridden. And fleas also can carry infectious disease. So fleas can spread tapeworms. If you didn't know, a lot of tapeworms are spread by fleas, as well as cat scratch fever, Bartonella. So they can spread pathogens. Fleas are very good at multiplying. They can live in your home. So if your pet brings fleas into your home, they can live in your carpet, in your bedding, in your rugs, in any type of soft surface in your home, and they can bite you. The other big parasite we cover with these preventions are ticks. There are a lot of different species of ticks. There are some species of ticks that are on the rise right now in the U.S. Ticks carry a lot of disease. Ticks are, I would say, right behind heartworm as what is something that we really want to be careful about preventing because they do carry so much disease. If you've never heard of Lyme disease, ehrlichiosis, anaplasma, babesia, Rocky Mountain spotted fever, these are just some of the diseases that they can carry. If you've never seen a dog, if you don't work in veterinary medicine, there is a condition called tick paralysis. So there are some dogs who have a reaction to tick bites where they actually become paralyzed. They have this like flaccid paralysis. Their hind legs usually stop working. It does resolve. most of the time when we remove the ticks, but it can be hard to find those ticks when we have a dog come in that's paralyzed. It can also initiate autoimmune disease. So tick disease can initiate, or tick bites can initiate immune-mediated disease that can cause joint swelling and joint pain and red blood cell and platelet abnormalities. So some tick-borne diseases are also zoonotic, which means it can be passed on to humans, especially young humans and immunocompromised people who are undergoing some type of like chemotherapy, or if they're ill with another chronic disease that can immunocompromise humans and make them more susceptible. So it's a very quick overview, but these are the parasites that we're really trying to prevent when your veterinarian tells you we should consider preventative medications. And the other thing to remember that in the U.S., we obviously have very different regions of the U.S. with very different weather and climate and elevation. So I'm going to sort of go through where the biggest risk of these parasites are in the U.S. in like regional. So heartworm disease, we really are seeing heartworm everywhere in the U.S. now. It is spreading. So hotbeds for heartworm, southeastern United States. Hello, here we are in Middle Tennessee. We are in a hotbed. So the Mississippi River Valley, the Gulf Coast are big heartworm areas. Texas, Florida, Alabama, Georgia, Louisiana, that's considered like the actual mecca of heartworm disease. But again, we're in Tennessee. We see a lot of heartworm disease. I diagnosed heartworm disease. I treated a dog for heartworm today. So in these higher risk areas of the U.S., year-round heartworm prevention truly is recommended, because if you've never lived in somewhere like Tennessee, we can definitely have warm times during the winter, and mosquitoes will find a way to be present anytime it gets warm enough. And again, heartworm is growing. There are climate changes, and there are warming temps and climate just pattern changes. And so we are seeing more heartworm. We also now, in the last several years, have had a lot more movement of pets across the U.S. A lot of people don't realize this is contributing to the spread of heartworm disease. So dogs carry the microfilaria, the heartworm larva, in their blood. And so a mosquito actually picks that up from biting a dog. So a mosquito that doesn't have it can take those out of the dog's bloodstream and then pass it on to another dog. So the spread of dogs from rescues and different organizations that will ship dogs from one region of the U.S. to the other for transport, which is a great thing because it helps with our shelter crisis. It's very real and very terrible, but it also contributes to the spread of heartworm disease. So a lot of people don't realize that is contributing. So again, if you're in an area where you're not sure if heartworm prevention is necessary all year round, there are some places where it gets cold enough in the winter that mosquitoes are less likely to be able to transmit heartworm disease. It's just a conversation to have with your vet. I think as time goes on, we have in recent years started to have concerns about resistance of heartworms to different preventions. And so I do think it's important that we as a veterinary community really think about where is year-round prevention most needed. This is, I can tell you from firsthand listening to some of the smartest people in this field, this is definitely a conversation that's being had. Where should we be doing this year round? Where can we take breaks in the winter? Things like that to decrease resistance. So again, this is a conversation that should be had with your veterinarian. They're going to tell you if that's recommended, and most vets at least should be able to advise you on when. But again, if you live in those hotbeds of heartworm disease, Southeast, Texas, Florida, Georgia, Alabama, Louisiana, here in Tennessee, you're going to want to give heartworm prevention year-round to fully protect your pet. All right, so fleas. Fleas are everywhere. You can have fleas everywhere. I used to practice in Western Colorado. Now, in the mountains, did we see as very much heartworm disease, fleas and ticks? No, we didn't. We did have some cases, but it was a lot less common. But again, here in the Southeast, anywhere where it's a warm, humid climate, so West Coast as well, has a lot of flea issues. Fleas can survive indoor year round because it's definitely warm enough in your house for fleas to survive. So if you live in a place where there are ever fleas, it's very possible that if they come into your home, they can just take camp and hang out through the winter. They can winter with you. So fleas can be everywhere in the U.S. Ticks, again, ticks are a little bit unique because we tend to have different species of ticks in different regions. So I don't know that we need to get into the nitty-gritty of the different types of ticks. Certain species of ticks carry certain diseases. We definitely, if you aren't familiar with Lyme disease, again, that is spreading the regions where Lyme disease is present, but the Northeast, Upper Midwest, those are the big areas we worry about Lyme disease. We, in the practice where I work in Tennessee, we're definitely seeing a lot more dogs have a positive Lyme snap on their annual heartworm and tick-borne test, which indicates exposure to these pathogens. And so scientists also definitely recognize Lyme as spreading. So Ehrlichia, I would say here where I practice in the Southeast in Tennessee, is a tick-borne disease that we definitely see a lot of. This is one of those that can cause the tick paralysis I was telling you about. And then in the Rocky Mountain states, you'll see more of Rocky Mountain spotted fever being carried by ticks. And then there are West Coast ticks that carry anaplasma. But again, I have seen all of these diseases pop negative on or positive in a test at our clinic in Tennessee. And again, we have a lot of pets that travel more than they used to. So we definitely see dogs that have lived on the West Coast who now live in Nashville. Lots and lots of dogs in Nashville used to live on the West Coast. Lots of California dogs here. So again, there are shifts in the patterns of these ticks as well. A lot of that has to do with climate pattern shifts and changes. And so this is an ever-changing situation. Again, if you are not sure about your specific risk of ticks and fleas and heartworm and intestinal parasites, your veterinarian should be able to tell you. And if they don't know, they should be able to find out from you because there are a lot of resources for that. There are resources for you to read about where these things are a concern. So this is what we're protecting against. If you weren't listening, there's a lot of disease that can be transmitted by these parasites. They're also gross and they make your pet uncomfortable. Tick bites can, even if they don't transmit disease, they can be very irritating. They can form these granulomas from the tick bite. That's like a hardened, irritated spot that can become infected. Our dogs and cats can bring ticks into our homes and we can get ticks. We're around them. That can obviously transmit to us. And we know that tick-borne diseases are definitely prevalent for people as well. So obviously these are major concerns. Another concern about ticks here where I live is cytox. So the lay term for that is bobcat fever. This is a tick-borne disease that is actually carried by bobcats, and ticks that have been on bobcats that are infected fall off. They get on cats, domesticated cats, and they cause this terrible blood disease called cytozoan felis, and the mortality rate in cats is really, really high. We see a lot of cases of cytox in cats in our clinic, and most of those cases are really, really sad, and cats either die or they have to be euthanized because they aren't responding to treatment and their prognosis is poor. So again, another serious implication of our pets having these parasites. Okay, so that is why your veterinarian recommends prevention. And there's a lot of talk right now about specific brands of prevention, specific drugs that are used for prevention. And I saw most recently a piece of content where I think she's a dog breeder. She has Labrador retrievers, which I love. She has an older lab who got really, really sick with a neurologic disease. I think this dog has passed away per her post. And she made this post to warn people that the type of prevention that the dog was on must have caused this disease, and it's so scary, and you should stop giving your dog this medication right now because it did this to her dog, and it's going to kill your dog too. And while it's very, very sad that her dog was sick and died, what she's describing in this post sounds like it sounds like cancer of some kind that led to some neurologic changes. And what she's describing really sounds like it can't really have anything to do with these medications, but it seems like the reason she's imploring that it caused it is because the vet neurologist she worked with told her to stop that medication. And herein lies just the kind of complicated nuance of medicines that, yes, there are situations where a pet may have some type of illness or condition where we're going to advise against certain medications, but it doesn't mean that medication causes it. And the other thing to remember is that there are a lot of people who are talking about all of these side effects from these medications, anything that is bad that has happened to their pet because their pet takes this medication, it must be due to that medication. The problem with that is something we call correlation versus causation. So you can correlate two events in the same pet or person's life that happen, right? So, for example, I drink Celsius a lot, okay? It's an energy drink that I love to drink. I drink it a lot of days. I have a Celsius. And there are theories out there that any kind of energy drink is so bad for you. And if I had any kind of medical event that happens to me, anybody that knows me could say, oh, it's because she drank Celsius, because that's something I do on a regular basis, right? But there's no way to know that it's caused by that unless there's some type of proof that there is causation there, right? So the same idea applies to what pets take on a regular basis. So monthly preventatives, food that they eat, even vaccines that they get on a regular basis, whether that's every 3 years, every 1 year, when beings are taking some kind of medication or treatment regularly, you have to be very careful about what you blame on that, because the timing, the mechanism of that action of that drug may not make any sense to the actual medical event that occurred. So I'm rambling a bit, but what I really am trying to say is just because someone said, oh, my dog had this XYZ issue and they were on ABC medication, they must be connected. If it's really not that simple, and there are a lot of false correlations we can make across any subject. And so it's just important to remember that correlation does not equal causation. And we're going to dive into it a little bit more. So I guess also before I start talking about the individual medications, this also is hopefully to serve to tell you that I've gotten a lot of questions like, oh, I've had my dog on XYZ preventative medication for 5 years and they've done fine. But then I saw this video and now I'm terrified and I stopped giving it. What should I do instead? And this is another principle of, a medication like that, a treatment like that. If your dog or your cat is receiving some type of medication and they are doing well on it, they are not having side effects, they've been having it for a long time, unless your veterinarian tells you to stop giving those things, there's really no indication to stop. Because even if something you hear online is true about a rare side effect that a patient suffered because of a medication, again, that is probably a rare side effect. And if your pet is already using that medication and doing fine on it, they're not experiencing the rare side effect. And in most situations, these medications are not going to have a cumulative effect. And so if they're going to have some type of a reaction, it's usually going to happen earlier on in the process of you using it. Now, that's not true of everything, but for these preventatives especially, I always talk to clients about, okay, let's try this. Let's see how they tolerate it. And if there's some kind of a side effect, we'll pivot. We'll try a different kind. We'll talk about other things. But side effects are possible. Every medication that anybody takes, every pharmaceutical, every nutraceutical, every supplement that you buy on the internet, every essential oil that you put in your body, all of these things can have side effects. And they do. Ibuprofen that you take for your back pain, ibuprofen can cause perforating ulcers. It can cause major side effects. It can cause fatal side effects. It's listed on the bottle, but lots of people take ibuprofen all day, every day because those side effects are very, very rare. And we take it because we need it, because things hurt and we'd like an NSAID for it. And so the same concept can apply to these medications. And we just live in a world now where, any rare side effect can be reported in a public way and shouted from the rooftops. And not that it shouldn't be reported, but it can be inflated and cause fear when it really shouldn't. And we call that fear mongering. Okay, I'm done rambling. Let's talk about the medications. So when you are talking to your vet about preventative medications, a lot of these are not over the counter. Okay, so they have to be prescribed by a veterinarian. They have to make sure your pet is healthy and can take these. And for heartworm prevention, also, we have to make sure your dog is free of heartworm disease. So they have to be tested first. So there are medications that treat or prevent heartworm disease only. Heartworm infection. There are medications. Most heartworm preventions are also going to cover intestinal parasites. So most of the heartworm preventions that are just heartworm on the market, we call them heartworm preventatives, but they also prevent or treat intestinal parasites. And then there are a lot of products on the market who are just for flea and tick. And then there are some products who just prevent fleas. And now, in more recent years, we have access to combination products that cover all of it together. I was a veterinarian before that existed, and I will tell you, we have been very grateful for those products. There are 3, I believe, now on the market that cover heartworm, intestinal parasites, fleas, and ticks. And they're very convenient. They are very effective. And as a veterinarian, we are very glad that they're on the market. So there are different ingredients that some of them are in the same class of drug that prevent these different parasites. So for fleas and ticks, we do have a couple different types of medications that are included in these products that prevent or kill the fleas and ticks. The most common drug class that we're going to see are isoxazolines. So that is the class of drug you see in a lot of big brands that cover fleas and ticks. This type of medication, it actually acts on the nervous system of the parasites that it's targeting. It paralyzes their nervous system and it causes them to die. And so and most of these are oral medications, that's what they are. And so when your dog takes them, it works by basically administering that medication to fleas and ticks when they bite your dog, and it causes their death. So the reason we do that is it prevents fleas from infesting your dog's coat, and so they don't lay eggs there and start the whole life cycle of a flea infestation. So it kills them as soon as they come into contact with your dog. And same goes for ticks. So these are very effective at killing ticks once they latch on, before they've been on your dog long enough to infect them with these diseases. And so that's why they work really well. When these medications are tested, all companies who come out with preventions or any pharmaceuticals for pets have to go through very rigorous testing, and the FDA is involved. And that testing that's done, there is research that's done. Animals are given these medications, and the side effects in those studies are listed. If you didn't know, in a lot of these safety studies, the animals in the studies are given high doses of these medications, higher than what's labeled, to make sure that even if these pets accidentally get a high dose of this medication, what are the possible side effects? So again, if you don't believe science and you think research is manipulated, you're probably not going to believe me, but I can tell you that it is not manipulated. The scientists that are performing these studies, they are not betrothed to these companies that have to fund these studies to prove that their products are safe. So these scientists are just collecting data, they're reporting it. A lot of times these studies are blinded, so they don't even know which product they're giving. They're just reporting what they see. This is another very big area of misinformation about research and how that actually works. One day we're going to have a guest on to talk about how that works, but that's what I'll say for now. So isoxazoline's most common flea and tick prevention you're going to see in a lot of these oral medications. In studies, very, very thorough safety studies, the most common side effects is going to be like mild GI upset, but there are neurologic side effects that are reported. And this is something that's getting a lot of attention right now. This is kind of what that content I was telling you about is involved in. There's a lot of fear mongering about these medications causing seizures. And so we're going to talk about that in just a second. I'm going to finish the different flea and tick medications, then we'll talk about seizures. So Fipronil is another one that is used. This is in more of a topical medication, so it's not a systemic oral medication. It's, again, very tested, very safe in a lot of dogs and cats. We are seeing an increase in flea resistance to this actual type of medication, Fipronil, because it has been around for a long time. We think fleas are sort of figuring that out, and we are seeing some resistance. Because this is a topical medication, the most common side effect we're going to see is like skin reaction just to the actual chemical that is the topical. Selamectin is another flea and tick medication. This is another topical option. It can cover some GI parasites and heartworm. So this is another combo medication that covers fleas but not ticks. And it can actually cover mites as well. This is when we use a medication that's used a lot for puppies and kittens. And again, side effects are pretty rare. I think reported for this one is drooling and lethargy. So overall, very, very safe, very low chance of side effects. And even if they have them, the reported side effects are pretty mild. The other sort of flea and tick prevention or medication that can be used, this is in a collar form. So it's Imidacloprid and Flumethrin. So it's a combination of these two medications. These do kill fleas and ticks on contact. This is a collar that lasts up to 8 months. There's been some drama about this collar as well. Again, anytime somebody reports that a medication caused a problem for their pet, that report doesn't mean that this person has proved some type of causation. It just means they're saying, my pet had this problem, my pet was taking this or wearing this or using this, and so I think there could be a connection. It doesn't mean there is a connection. So skin irritation, again, is a most common thing we see with the collar type preventions, and they can have hair loss at the site of the collar as well. So isoxazolines is the class of drug that we use for flea and tick prevention that does do something that we can connect to seizures, okay? So I will hear people talk about, oh, this medication caused my dog to have a seizure condition. And the problem with that statement is what we know about these medications is that they can lower the seizure threshold. This is a known effect. What that medication is doing for the parasites, so it's affecting their neurological system. In a normal dog, it should not affect a dog's nervous system, neurological system. But in dogs who have underlying seizure conditions, these dogs get affected differently. And so it can do what we call lowering their seizure threshold. So they have a seizure condition that's underlying. They may have never had a seizure before. A lot of times we start these medications in young dogs, and they take this medication and it can lower their seizure threshold, which means they're more likely to have a seizure. They already had seizure activity, proclivity in their brain, in their neurologic system, and this accelerates that and causes the seizure. Now, seizures are very scary. Seizures are a side effect of any medication that is scary, and nobody wants anyone's dog to have a seizure. And so in general, we do see this. I think in studies, the incidence of any type of neurologic side effect from isoxazolines is less than 0.01% of the patients that take it. And even if it's higher than that, because some of these situations or cases don't get reported, it is a very, very low incidence of this because it is a pretty low population of our dogs that have underlying seizure conditions. And So I talk about this, and I don't want to discount that seizures are scary. And if your dog has never had a seizure, they take a medication that lowers their seizure thresholds. And this is not the only medication, by the way, that can lower seizure threshold. But they take that medication. We don't know they have a seizure issue. They have a seizure. That is very scary. For me personally, as a veterinarian, if I have a patient who starts a medication that includes an isoxazoline and they have a seizure, that is within the first few days, especially of taking it, we have a conversation, one, about what are the possible causes of that seizure, and that medication is included. That could have lowered the seizure threshold. That could have unmasked an underlying seizure condition, and we're going to deal with that. In most of my patients, if they have a seizure after starting one of these medications that includes an isoxazoline, I'm going to take them off of that class of medication because it may have lowered their seizure threshold. And usually, or in a lot of patients, they don't have any more seizures when we take them off of that medication, or they don't have seizures again for a long time until later in life when their seizure condition was going to show itself anyway. And so, there is also a time frame where these medications have effect for those 28 days or so, and then they're not really causing any effect anymore. And so sometimes I'll hear people say, oh, my dog took this medication once, and then 5 years later they started having seizures. And I can just tell you right now that there's no connection between those two things. And so this is, I would say, the probably most sensational thing right now about these medications is about the isoxazolines and seizures. And so, yes, taking those medications, dogs who already have an underlying seizure condition, it can cause their seizure threshold to lower, so they're more likely to have one. Most seizures, if they have an isolated seizure, are not going to cause long-term damage. They are scary. They're very scary. But in most cases, even of all the dogs that have that side effect, they're not damaged permanently or severely by the seizure. It's scary, but in most cases, we're just not going to give that class of medication anymore. And when that happens, we talk about other ways to prevent fleas and ticks. We talk about collars. We talk about topicals that would work. And we pivot and we go from there because we still want to prevent fleas and ticks. That's just not a good option for that pet. So I hope that makes sense. Lots of questions about that. It is what it is. We in veterinary medicine and all medicine, we have to mitigate risks of both diseases and medications that we use, right? So in any medical situation, if we're going to use medications, right? And most medications carry some risk. Most treatments carry some risk. Anytime we do a surgery, we carry some risk in the things that we do, and we have to weigh the risk and the benefit. I and veterinarians, we see the risk of leaving, especially certain areas of the country, of leaving pets unprotected from these parasites because we are the people who see the dogs who are in cor pulmonale because they have end-stage heartworm disease. We see the dogs with tick paralysis and tick-borne diseases and autoimmune diseases that owners can't afford to treat because they weren't on tick prevention because someone scared them on the internet. We are who see those results. And there are a lot of people who are like, well, I hear a lot. I grew up, my dogs never had heartworm prevention and they were fine. And that is true of a lot of pets. Not all pets who don't take prevention are going to develop those diseases, but some of them do, and they are. And, you don't know what you don't know until you realize you didn't know it. And so I can tell you, people whose pets are diagnosed with these diseases who weren't on prevention, I hear a lot from them too. Gosh, I had no idea. I didn't think this would happen. And it happens, especially in places like where I practice, where there is such a prevalence of these parasites and these diseases. So those are sort of the major classes of medications that cover fleas and ticks in these products. And then we talk about heartworm prevention. So the interesting thing to me about heartworm prevention is I do see content a good bit where people are speaking out against heartworm prevention and saying that you should try their holistic supplement for heartworm prevention instead of veterinary products that prevent heartworms. And it's very almost humorous to me because in my experience, a lot of the people who are trying to go against heartworm prevention and discouraging that have a very sort of holistic approach to a lot of things. A lot of these people have talked about humans taking ivermectin for different purposes during COVID, the height of the pandemic. There were a lot of people who truly believed that ivermectin could treat COVID and was a preventative measure for COVID. So the ironic thing about this is that the class of drugs, macrocyclic lactones, that ivermectin lives in is overwhelmingly what is used for heartworm prevention in these preventative products for dogs and cats. So, yeah, it's kind of funny, but ivermectin is an ingredient in a very long-standing popular heartworm prevention. It's very, very safe. So other medications in that class that are used in these other forms of prevention or brands of prevention. So you have ivermectin, milbemycin, moxidectin, and selamectin. So very similar drugs. We actually are concerned now about some resistance in ivermectin, heartworm resistance for ivermectin in places like here where we have a hotbed of heartworm. And so these combo products contain some of these other options like milbemycin and moxidectin, and we think that they may actually be better at preventing heartworms, at killing the larval stage of the heartworms to prevent adult infections. And so there's a couple different heartworm prevention medication options. They're all very, very safe. Studies of these medications have been done extensively, and they are overwhelmingly very safe. Another myth about heartworm prevention is dogs with the MDR1 gene mutation. This is a very, very big myth in the dog world. There are people who will tell you that heartworm prevention is unsafe for dogs who have an MDR1 gene mutation. These dogs generally are collie type breeds, so border collies, shepherds, there's a lot of different breeds that can carry the MDR1 gene mutation. This is a gene mutation. It's actually somewhat rare. You can very easily test your dog for this gene mutation with a saliva test. So it's people think it's in more dogs than it really is, but it exists. Some dogs have MDR1 gene mutations, and it makes them more sensitive to certain medications. And this class of drugs that ivermectin and moxidectin and all that is one of those drugs that they are more sensitive to. But if you didn't know, the doses that our veterinary prescribed heartworm preventions carry in these medications have been tested in MDR1 dogs, and they are safe in these dogs. So that's a big myth. MDR1 dogs, it is safe for them to take these preventions as well. And again, you can get your dog tested for an MDR1 gene, and if they're negative for that gene mutation, then you literally don't have to worry about it at all. But even if you have an MDR1 dog, science says that the doses we use for our veterinary heartworm prevention are safe, even for those dogs. So again, these heartworm preventatives often combine one of those medications for heartworm with a dewormer. So Pyrantel pamoate is one of the common dewormers. Fenbendazole is another one. Praziquantel, that covers tapeworms. And then there is a cat dewormer that includes imidacloprid, I think is how you say that. And these are, again, very safe medications, very safe dewormers. They have great efficacy, and they treat these GI parasites that can cause so many problems. Again, deworming intestinal parasites, some of these are zoonotic, so they can be transmitted to children and immunocompromised people in your home. So just another really important reason you're going to want to keep your dog and cat on dewormers, and that's what monthly preventatives can do for them. What I tell my clients, we have a lot of cats at our practice who are indoor only. A lot of those cats don't take monthly preventatives, which is up to everybody that has cats. We definitely offer it for indoor cats because we all know all of these parasites can make their way inside, especially if there are other pets in the home that go outside. Outdoor cats, we definitely are recommending these preventatives for all of them. Cats can pick up heartworm disease. It manifests in a different way in cats, but they also get fleas, ticks, and intestinal parasites. And So what I do for my patients that are cats, if they're not on routine prevention that includes a dewormer, I like to test their fecal samples for intestinal parasites at least once a year. And in general, I typically say let's deworm them once a year if they're not on a regular prevention. So those are the different classes of medications. Okay. So there are some medications that are just going to be heartworm prevention and intestinal parasite prevention. And then there's some medications that are just going to do fleas and ticks. And then we have the combo medications. And these combo products, they're just combining a combo. It's usually 3 of those medications to cover those 3 categories: fleas and ticks, heartworm, intestinal parasites. And the doses that are used in these combo products are, the companies are very methodical in the doses that they use. They use research and studies to establish what dose they want to use. And then once they decide on the doses of everything, put it all together. Again, there's very rigorous studies that are done to determine safety. And for FDA labeling, they just present this science, the data, the results of these studies to the FDA, and the FDA does what they deem is best with that information. So that's kind of the breakdown of what your preventative options are. I don't have a really strong preference in my patients of if they're on a combo product or 2 different products, one for heartworm intestinal, one for flea and tick. I do like the convenience of the combo products. If the pet tolerates all of the medications that are in the combo product, there's no reason not to give them that. Again, if we have patients who we know have a seizure condition or a neurological condition, or we see a weird side effect from these medications, we're going to split it up and do different options. The most common side effects we see in all of the oral medications that we offer is going to be GI side effects, so vomiting, diarrhea. This is really the only thing I ever really hear about from our clients is GI upset. Sometimes we can connect that to taking the medication because it happens 2 or 3 months in a row, and it's always within a couple days of giving that monthly preventative. And again, that is a rare but possible side effect, and it happens sometimes, and we pivot. We try a different product. I definitely see patients who they take one combo product. It may cause vomiting or diarrhea, and so we don't give that anymore. We try a different combo product, and they do just fine on that. And then sometimes they just don't do well on any of the oral products, and so we talk about topicals or collars. So that is the good thing about having all of these options. We can tailor the protection against these parasites to what works well for our specific patient. So I knew this would sort of be a short episode, but I just wanted you to hear from me. Here's the deal. You can look up those medications, the drugs that are in the medications and what brands have what in them. Again, what I tell my clients, I don't have a strong preference for what products they use. We try to keep it simple. We carry one product for each of those coverages in our clinic so that we're not trying to keep a bunch of inventory. We just want to have an option for people. We don't care what our clients use, though. They can buy that from us. They can use a different product. I definitely have patients who are on totally different products from what we carry in the clinic. There are some products that last longer than a month. There are injectable products that can prevent heartworm and intestinal parasites for 6 or 12 months. And there are some flea and tick oral options that last for 3 months. A lot of people really like that. It can be very convenient when it lasts longer. It's hard for people to remember to give preventatives. And so, we have a lot of clients who say, hey, I'm not going to remember to do that every month. And so I want a 12-month shot. And I think that's great if that's what people want to do. And, again, there are risks and side effects to any treatment, any medication we do. I think what happens is if pet owners don't really understand the risk of not giving the prevention because they haven't seen that with their own eyes, then they hear mostly about the risks of giving it, and that can scare them from doing it. And I totally understand that. I don't think any veterinarian would tell you, there are no dogs that have any issue with any preventatives. We're all aware that there are possible side effects, but the reality is that they are very, very rare. And like I said, we see the alternative. And in a lot of situations, the alternative can be heartbreaking and expensive, and in some cases, it can be fatal. So I hope this is helpful. I am happy to answer any follow-up questions about it. I do think it's very important that you chat with your vet about it. If you have concerns, if you're worried, it's okay to be worried. If your vet tells you it's not okay for you to talk about being worried, then find a different vet. It's okay to be worried. And, you should be able to talk through these things. I always want clients to be as comfortable with what they choose as possible. And we can talk about worst case scenario. What's the worst case scenario of side effects? Your dog has a seizure. We're going to not give that anymore. And, I think if we just all are honest and transparent, which your veterinarian is, that they may just not know you want to talk about it. They're not hiding anything from you. And the reason they recommend the preventatives is because they, like I said, they have seen the alternative and they just want to keep your pet safe. And you also cannot agree with them. But there's no, ill intent in recommending them. Another thing I get asked a lot is, do I really have to get my dog tested for heartworm prevention every year? And it's a fair question. That can be confusing for people. We do in general recommend a heartworm test has been performed once a year before we prescribe heartworm prevention. And that's because some of the heartworm prevention products can be dangerous to give if your dog is infected with heartworm at the time that we give it. And so that's why companies do recommend that we test annually. Another thing a lot of people don't realize is that a lot of these companies, if your pet is taking their medication and you're buying it and they're taking it every month or whenever it's due, and they still get one of the issues or diseases that it's supposed to protect against, these companies most of the time will cover the cost to treat that. And so that's another reason why we always test annually, because if God forbid we ever have a patient who slips through the cracks of that medication, they get heartworm disease despite the preventative, which does happen sometimes, then we want to be able to catch it so that we can treat the heartworm before it gets worse. And so those are the big reasons why we test for heartworm disease before we keep prescribing it. Some people really have a problem, clients have a problem with that. And I think a lot of it is just the cost. And these preventatives are not super cheap, and so I think that cost has a lot to do with when people are concerned about the testing, because it's just a little blood draw. But the reason is for safety for your pet and for your dog. And so if you've ever been in that situation and you were confused, why did my vet make me do that blood work before they gave me more heartworm prevention? Or like if your dog's been off for 6 months, that's why, because they just want to make sure it's safe to restart it and make sure that your dog doesn't have heartworm disease. Okay, I have a couple questions and then we're gonna call it a day. So I put a question sticker up, I think it was yesterday, and let's see what your questions are. Okay, great question. Deanna is one of my wonderful followers. She's been around a long time. And she said, do edible heartworm flea tick preventions keep pests from biting, or do they kill pests once the pet has bitten? So, yes, so like we talked about, a lot of the oral systemic medications that are preventing the flea and tick part, they do need the flea and tick to actually bite and come into contact with your dog's bloodstream to actually kill that parasite. There are, the topical options are different, so that's a contact issue. There is one that has some repellent action, we think, but yes, the edible preventions, they work once the pest has bitten your dog. But the cool thing about them is that, like in ticks, like I said, it takes a certain amount of time for them to transmit disease. And so that medication is effective at killing the tick before that transmission can happen. So that's how that works. Let's see, another question. Okay, I've got another good one. This is from Carrie Ann D1. She said, advice. Penny is on a flea, tick, and heartworm prevention, and we are still bringing home ticks on our hikes. So this is kind of goes with the last question, but what I do tell clients, if they have dogs that they're taking out in the woods on hikes, and heavily infested tick areas, I do think adding on another layer of protection is a really great idea. So there's some good products on the market that are flea and tick sprays that you spray on your dog or before you go out into the wilderness, into the woods. And so that's just an added layer of protection. And I think that those are a great idea for when you know you're going out into the woods where there are a lot of ticks and fleas. And so even if they bring the ticks in because they're on them, those ticks are going to die once they bite and actually take in the systemic medication, but they can end up in your home. And so that is another added level of protection that can be very helpful. I also definitely recommend that you check your dogs and cats really well for ticks if they have been out, and when they come in, their armpits, so leg pits and armpits are a good place. Anywhere warm is where ticks like to go. Behind their ears, we see around their eyes, their anus actually, just anywhere on their abdomen, around their neck. These are kind of the crevices where we'll find ticks. So they like to burrow into a warm, dark place. So another really good thing to do. Tick check for the dogs and the cats too when you come in. Here's one last question. Future rural vet, I think this is a vet student, love that, said best and safest to cover all of my bases. Was on 2 different products. Now I'm on a single product. So this is something that's very important that I really need pet owners to be more educated about. So at our clinic, anytime we see a patient, especially for an annual visit, we're going to check what medications are they on. We want you to tell us what's the name, because if we just say, is your pet on heartworm, flea, and tick prevention? All the time, people are like, yep. And then once we probe, okay, tell me what medications they are, they'll tell us a flea and tick only medication. And they thought they were on heartworm prevention. And so that's where all these different medications and brand names get very confusing, because there are combo products and then there are separate products. And so this is why, if you are not sure, so I'm talking to you, if you live somewhere where your dog should be on heartworm, intestinal parasite, flea, and tick prevention, and you think they are, I want you to go look at what medication you're using. And if they are on a medication that is covering heartworms, they either should be getting an injection that prevents heartworms for them, or they should have, the box should say this prevents heartworm disease. It should have a medication that's going to end in ectin or icin, and the box should very clearly say what is being prevented. So it's very important to know exactly what you're giving and what it's covering. We try very hard to be very diligent and very thorough and make sure we educate in the exam room and we explain you need all of these. But with the names and everything else going on, it can get very confusing. So you as a pet owner, especially if you have a dog, you want to make sure you're covering all of those things. If you have a cat that goes outside, there are combo products that do cover heartworm and fleas. A lot of these do fleas and other parasites, intestinal parasites. And so you just want to know what you're getting covered. And if you feel like there's a gap or a hole in coverage for your pet, absolutely reach out to your vet. Say, hey, I thought we were on both. We're only on this. What do we need to cover our dog or our cat? Okay. I hope that is helpful. This has been another episode of the Dr. Molly Says podcast. I hope you enjoyed it. Feel free to download our episodes anywhere you listen to podcasts. Leave a review if you feel so inclined. You can follow me at Dr. Molly Says, and you can follow us, the podcast, and look for episode clips at Dr. Molly Says Pod. And you can send me a question. You can send a direct DM to the podcast page or to my page. And we also have a link in our bio where you can submit a question for our question section of the episodes. I will see you guys next week.